in on many information regarding the political diary and what is happening. But let's just follow up with the story that began yesterday. This is about the Kenya health workers who are holding their second day conference at Safari Park. And Sada Hassan will tell us more about that particular event and what does it portend. Also, we know there is a rise in cases of COVID-19 in the world. We had the World Health Organization saying don't really slow your roll yet. As far as the COVID-19 protocols are concerned here in the country, we had pronouncement from the ministry that we can lose our masks. But Jinlin in China is under lockdown because of rising cases of COVID-19. And I want just to rope in Sada Hassan. Good morning, good to see you.
Good morning, Deval.
Yes, let's just first of all begin with that particular conference that is ongoing today. What is it about and why now?
Right, so today it is the second day of the Health Workers Convention at Safari Park Hotel. Yesterday they had their first day and key issues were discussed, one of them being how COVID-19 pandemic affected the health workers because we witnessed that health workers were really affected by this pandemic because some of them lacked the personal protective equipment and some of them were really exposed to this disease because it is still a new disease and we're still trying to figure out how to handle it, how to work with the mutations that are coming in and out. So yesterday that was a key issue that was discussed by the health workers. Apart from that, they also discussed social financing, health financing, and today that will also be taking place. They will be discussing strategies, how to move forward as we continue working with this pandemic, as we continue facing threatening issues that are coming in, day out, because with viruses such as COVID-19, we expect mutations to keep on coming in and out every now and then. But apart from that, it is also important to mention that COVID-19 cases are seen to be rising in some countries, and they're now reverting back to some of the measures like putting on their face masks and also partial lockdown. But here in Kenya, we've seen the numbers go down really low numbers compared to where we were maybe a year ago or even 2 years ago, because right now we're almost 2 years into fighting the COVID-19 pandemic, and Kenya has come a long way in managing this particular disease. Right now we are going towards the elections, and it is quite critical for us to still adhere to some of the measures that were put in place by the Ministry of Health, despite the relaxation of measures like wearing of face masks, because as people continue gathering, as people continue meeting, then you never know who might be carrying the virus, and that is why the ministry said even if we are told to stop putting on the face mask, you should still be able to adhere to some of the protective measures just for your own good. So this is some of the stories that we'll be following throughout this day.
Right, I was just listening to some of the conversation yesterday with the Kenya Health Workers Conference there, and they were picking up the issue of COVID-19 and the long COVID-19, the way it's affecting people. After the effects of having the pandemic, people are living with the effects of COVID-19, like some of them also, they're still on oxygen bottle. Some of them also, they have post-exertion malaise that is there. You know, you're feeling migraine headaches at the end of the day. And the question of coverage, when you're talking about NHIF as well, came to bear. I don't know if you followed up on that as well. And you talked about the variant. I was reading from other news sources as well that we have a new variant. They're calling it the Delta Omicron, which is just a coinage of Delta and Omicron together. They're saying this is a rising case in some parts of the US, but it's not really been confirmed by the World Health Organization. And that particular moniker also is not officially the name that the World Health Organization is giving. Are you privy to this?
All right, yes, absolutely. First of all, when you talk about NHIF financing, we know that when the COVID-19 pandemic started, then NHIF mentioned that they're not going to cover COVID-19. And this was quite a blow to Kenyans, because you find that majority of those who are hospitalized and those who required ICU or HDU services were really suffering because they had to go back to their pockets to be able to cater for some of the expenses that occurred or that were incurred during the whole process. So as the health convention is still ongoing, this is some of the questions that the health workers are asking. How is NHIF going to ensure that moving forward, because these pandemics are something that we are still going to witness, because right now we're facing issues like climate change, and all of this go back to how living things mutate, how viruses mutate, and all of these are going to affect how we work as a country. And this is some of the questions that health workers are asking. And about the COVID Omicron, yes, these mutations will keep on coming, so it is up to us to know how to handle them.
Much appreciated, Saada Hassan. Let's cross over now to the coast, where Tobias Chanji is